Hello everyone, this is Dr. Nakul Hamata. This is a small video on diabetes and its types. So diabetes is a condition which is characterized by a high level of blood glucose, which is commonly referred as blood sugar. Too much of sugar in the blood can cause serious and sometimes life-threatening conditions as well. There are two types of chronic diabetes condition. They can be type 1, type 2, whereas pregnant women may acquire a transient form of diabetes which is called as gestational diabetes, which usually results after birth. Prediabetes is a condition when blood sugar level is at the borderline, which is higher than the normal but lower than diabetes. This may or may not progress to diabetes. During food ingestion, carbohydrates break down into glucose, which is carried out by the bloodstream to various organs of the body. Insulin is a hormone which is produced by beta cells of pancreas and is necessary for glucose intake by the target cells. In healthy patients, beta cells of pancreas produce the insulin. The insulin binds to its receptors on the target cells and induces the glucose intake. In type 1 diabetes, the beta cells are destroyed by the immune system by mistake. The reason is unclear yet, but genetic factors play the major role. Insulin production is reduced, less receptor binds to its receptor on the target cells, and less glucose is taken into the cells, and hence more glucose is taken into the blood. Whereas type 1, it is characterized by early onset. The symptoms start suddenly before the age of 20, and this is managed by insulin injections. Thus type 1 diabetes are insulin dependent. Whereas in type 2 diabetes, the pancreas produces enough insulin, but sometimes something goes wrong into that, either with the receptor binding or insulin signaling inside the target cells. Thus, the cells are not responsive to insulin and hence cannot import the glucose inside, and hence the glucose stay in the blood. In other words, type 2 diabetics are insulin resistant. The genetic factors which predispose the susceptibility to disease, whereas lifestyle also plays an important role in type 2. Typically, obesity, unhealthy diet, and inactive lifestyle are associated with higher risk of diabetes type 2. It is characterized by adult onset. Symptoms appear gradually over here and appear usually after the age of 30, and it counts for about 80 to 90% of all the diabetics. The management generally focuses on weight loss, food with low calorie and low carbs. Whereas if we talk about gestational diabetes, it is the diabetes which occurs during pregnancy. It is one of the most common health issues that occurs during the pregnancy. It happens when the mother is first diagnosed with diabetes pathway through the pregnancy. A diagnosis of this gestational diabetes puts a pregnant patient into high risk category. The key to minimize the effects of gestational diabetes is diagnosing it as early as possible with the use of oral glucose tolerance test. If gestational diabetes is not diagnosed correctly, it can lead to macrosomia of the baby, and it can put the baby at the risk of neonatal hypoglycemia, trauma, and other complications. It can also lead to jaundice, premature birth, birth asphyxia, and reduced uteroplacental perfusion, which harms the baby by reducing the passage of oxygenated blood from the mom to the baby. So that's all about the types of diabetes. Thank you.